You are the president of International Ortomoleküler Medicine Society. Can you briefly explain what is the ortomoleküler medicine?
Ortomoleküler medicine writes molecule and to make the body healthy.
Who are the Dr. Baghli?
I start to learn and to share about integrative therapy for my patient. I create in 2009 the Algerian Society for Ortomoleküler Medicine.
Can we change our biology with thinking?
We share for more than 800 doctors and biologists and psychologists training. I invite young doctors and also old doctors because we can have a new step in our professional life, each moment in our life.
Ladies and gentlemen, welcome to our Ortomoleküler Medicine Talks. Today we are very happy because very famous Dr. Ilyes Baghli here in Istanbul for our congress. Welcome, Dr. Baghli.
Thank you.
We are very honored
Me too.
you are here. Let's start our talks. If you are ready.
Yes, welcome.
Okay. Introduce yourself briefly. Who are the Dr. Baghli?
Dr. Ilyes Baghli was born in Algiers, in Algeria, Cezayir. Doctor in medicine from Algiers Faculty of Medicine in 1992. I start to learn and to share about integrative therapy for my patient. I learn a lot of way to give the best for patient, like nutrition, like ortomolecular medicine, like neuroscience, to go to the real causality of disease and to make patient more healthy. And I create in 2009 the Algerian Society for Ortomolecular Medicine.
Roughly 15 years ago.
Yes, for the history. I was here in Istanbul when I write and I make the strategies.
Oh,
so it's a
starting point.
Yes, I was in March here, 2009. And in 27 May 2009, we create the Algerian Society for Ortomolecular Medicine at the same moment, at the same time when Abraham Hofer passed away. It's like we take the torch.
Yes.
It's amazing. And we start training in 2011. We do more than 36 international congress training.
36.
Yes, and we invite professors from different countries, from different continents, and we share for more than 800 doctors and biologists and psychologists training. And
800.
yes, and we share 36 magazine of ortho. For each congress, we share magazine, and also we share around 7,000 page
of
information. It's Ortho DZ from 1 to 6, and now it's in National Bibliothèque in Algiers. Next this tape, I was introduced as new president of International Society for Ortomolecular Medicine the 1st June 2023 in Sao Paulo in Brazil. And I success to Professor Atsuya Nagishawa from Japan. And the ISOM, the International Society for Ortomolecular Medicine, is in Toronto in Canada. And now I support training and to create new society. I am very honored to introduce Turkish Society of Ortomolecular Medicine as member of International Society for Ortomolecular Medicine and to be with you in this international congress and also by sharing 2 conferences. And it was very interesting sharing and learning with you.
Thank you very much. This nice information. You are the president of International Ortomoleküler Medicine Society. Can you briefly explain what is the ortomolecular medicine for newcomers?
Yes. Ortomolecular medicine was created by the double Nobel Prize Linus Pauling in 1968 to treat with the right molecule and to make the body healthy, not to treat only a symptom, but to go to causality. We use molecule exist in the body, like vitamin, like oligo elements, like amino acid, like coenzyme, but also other like cortisol, like ozone, like hydroxy, carboxy therapy, hyperbar oxygen therapy, all included as ortomolecular medicine because what exists in the body can be used as ortomolecular therapy.
Okay, thank you. I heard from you very interesting news. You know Kennedy, the president, health minister of USA.
Yeah.
Can you say something about Kennedy, your relation, your friend of USA doctor, Make America Healthy Again, MAHA project, and COVID, your COVID experience very interesting.
No, our relation with USA starts in March 29, 2020. We share about therapy of COVID by vitamin C in Wuhan. And we share about using vitamin C intravenous therapy with Dr. Penn. And it was published in New York Times. And also in Algeria, I share with health ministry by Zoom with all doctors in Algeria how to use ortomolecular medicine as treatment in emergency in COVID or as prevental and also as therapy. And our collaboration was very integrative, and we use like some hospital, like Oran Hospital, with using ortomolecular therapy also for emergency. When we published a hybrid ortomolecular protocol, I am principal author. You have to know that as co-author, we have also Paul Maric, who is a doctor very close with Kennedy, and he shared our view and his view to introduce it in USA. And now more than 13 states in USA use hybrid ortomolecular protocol for treatment of cancer by using antiparasite therapy and also ortomolecular medicine. Yesterday, at the time of Congress in Istanbul, in Florida, decided to use hybrid ortomolecular protocol for treatment cancer in Florida, and they share to use a program with more than $60 million to make it happen. So we are at a step in the history of humanity where orthomolecular medicine and also integrative therapy has a place with allopathic therapy to make it happen for the benefit of patients, of citizens, and for the humanity.
Humankind.
Yes, of course.
Very good news for us, Florida starting. And you say hybrid protocol, and you came to Istanbul to give 2 speech and 1 workshop, and you introduced to us, thank you very much, hybrid protocol. Can you explain briefly hybrid protocol? And next, what's your impression about our Congress? And what's your future plan, 2070, big Congress in Istanbul? 3 questions.
Yes, of course. Istanbul, I share the hybrid orthomolecular protocol for treatment of cancer in workshop. And this protocol, before to do it, we study more than 200 ways for treatment. But we make choice for 7th way, and we share it in a publication on Ortomolecular Medicine Journal. We published it in September 19, 2024. So it's very 1 year ago. And in this protocol, there is a part for orthomolecular medicine, of course, like using vitamin D to make the level of vitamin D more than 80 nanogram by milliliter, to use 50,000 units a day. Also about vitamin C, to use 1.5 grams by kilogram a day, and also to use zinc as 1 milligram a kilogram a day. But there is also in reference other study to invite to use other cofactors like coenzyme 1 NADH, coenzyme Q10, vitamin E, also selenium, also magnesium, of course, complex B. So it's a global orthomolecular therapy. And also we share about that cancer cell work like parasite. So for energy, they use the same energy way by using glucose and glutamine. So every anti-parasite therapy is an anti-cancer therapy. Without sharing about the relation between parasite and cancer, no. We say cancer cell work like parasites. So anti-parasite therapy is also an anti-cancer therapy. So we share protocol by using ivermectin. Example for low-grade cancer, it's 0.5 milligram by kilogram a day. For medium grade, it's 1 milligram a kilogram a day. For high grade, example, it's from 1 to 2 milligram kilogram a day. Also, we share about fembendazole. And for fembendazole example, we do publication about 3 cases treatments for breast, prostate, and other cancer in Karger Publisher. It's in Switzerland. It's oncologist publication. And we share it in May 27, 2025. But we pay to make it free.
Oh.
So we have a second publication in June 30, 2025. And all people can learn more about this publication because we create oncoparasitology therapy as a new way for treatment of cancer. And also we share, of course, about mebendazole, example 200 milligram for low grade, 400 milligram middle grade, and 1,500 milligram for high grade of cancer. And also we share about albendazole, flubendazole, and also about DON. DON, who can stop using cancer cell glutamine. And the other way of treatment is about fasting, water fasting, long time fasting, and also about keto diet, about the importance of get protein and fat, eat and to eat meat. And this is important for being healthy. And also about activity, physical activity, like walking every day 30 minutes, or like walking every 2 days 45 minutes, or every 3 days 75 minutes. But other protocol also was shared, like hyperbaric therapy and pulse therapy. So we share also like about blue methylene, about other therapy that we can use it. So each doctor can use hybrid orthomolecular protocol as a matrix for his treatment, and he add what he learned. Example, allopathic therapy, chemo or radiotherapy, surgery, of course, Chinese therapy, medicine, or other. And what is interesting, that it's we treat the causality, we reduce the side effect of allopathic therapy, and we make allopathic therapy more benefit. So all are in the way for winning and to give the best for patients. So for that, we invite to more sharing, and we are happy to do training for that. And I was very impressive of the Congress in Istanbul. I share about anti-inflammatory program, and also about the hybrid orthomolecular protocol. And a lot of doctors ask me details, and we share a lot. So people are really interesting. The Congress was in a high level sharing, and also we meet a lot of people. So we are really honored to make it possible also in Turkey, and to introduce it by training with Ortomolecular Academy and with sharing about.
We are very exciting waiting you in the big congress. Your protocol is very paradigm shift, big event for world. You are very famous to make paradigm producing man. Recently, you are introducing some interesting idea. For example, emotional intelligentsia, spiritual intelligentsia, neuroscience, for example. Can we change our biology with thinking? Thinking of way is good for treat disease or healthy lifestyle change methodology, for example?
Yes, of course. You know, in our publication of April 17, 2024 in MDPE about targeting mitochondrial relation between stem cell and cancer, we share about the memory in stem cell and that we can have a cancer in organ and we can have a second cancer, but it's not metastasis. It's the memory in stem cell from the first organ. So it's, again, a first cancer from old memory. So to make reset zero stem cell is really important to create normal cell from stem cell. Mm-hmm. We can do it by introducing ortomolecular medicine, of course, to support cells. Also by detoxification, if there is heavy metal, pesticide, and other toxicity. But also, it's really important to make the biology of life. Because when you know, and it's never like before. And people can be sick because they didn't keep by them personality in their life some different things. So disease can be like a way to get a new posture in society. To keep out benefit of disease in the life is important to be healthy, because what can keep for you disease in your life, in your family, society, professional, if you keep it by your personality, you will be healthy again. And it's important to support and to make change all the transgenerational trauma as cultural legacy, to make free from neuro-emotional trauma and to find a way of your neuro-existential choice. If you are free to be in emotional intelligentsia, you can do the best things in the best way with the good person, in the good place, in the good time, in less than 3 seconds. If you are in introspection, you can say no, you can say yes, you can say stop, you can say let's go, and you are healthy because you don't do what you cannot do it. And if you are in spiritual intelligentsia, you are ready to keep more better than the better dream in your life. This neuroscience can keep a lot of things to make the biology healthy and to change the biology of the person. For that, you have to be in the memory of the future to change your present without caring about your past, because the past is a training, is a teaching for you. And when you change your view of your life will be very nice, amazing. And this is what is important for a patient, because we have a person with the memory of all humanity, with not only biology, not only clinic, not only toxicity, but a spiritual person also with existential. So we have to do an integrative, global, multidimensional, holistic, and personalized approach to take care of our patients. And thank you.
Wonderful, wonderful. One more question, interesting question. What's your advice for young people, for young doctors, for young health professionals in the future? Very important for us, your idea.
Really important, because, you know, a doctor or a psychologist, a nutritionist, pharmacist, physician must know that there is a quantum relationship between them and patient. They cannot give what they didn't have. So they have to be healthy first. They have to be good emotional life quality, because if they want to give support, they have to be healthy, biological, mental, existential, and they have to love and to love what they do, because a professional heart is the principal way to make good result. I invite young doctors and also old doctors because we can have a new step in our professional life, each moment in our life. And we have to make medicine integrative approach because we have to use different way to support the way to make our patient healthy. So knowledge, training, and open mind, open eyes, open heart can give to the doctors of today and of the future the best way by combine different way by using example ortomolecular medicine, nutrition, detoxification, antiparasitic treatment, neuroemotional support, neuroexistential support, but more than this. So they have to be more open mind and more asking for knowledge because this is the way to get the best for them first and for patient and also for their life with their family and society. So to be in equal way is really important. And thank you.
We are entering new medicine area. Young professional, welcome to Ortomoleküler Medicine. And we have a good news. Next year we have a big congress in Istanbul. We are inviting all professionals and we are honored and thank you, Dr. Ilyes Baghli. We are very, very happy and thank you very much.
You are welcome. Thank you.
Okay.
And we support Turkish Society for Ortomolecular Medicine to do international congress here in Istanbul or other towns in Turkey. And, your symbol is Istanbul Bosphor light. And we hope that you will be the light and you make luminosity for new step for medicine in Turkey and also around the world. Thank you very
Arigatou
much.
gozaimasu.
Thank you very much.